Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is doctors subconsciously influenced, specifically by the pharmaceutical industry. Now, what I have here is a chart from a study in 2015 of physician prescribing in Washington, D.C. But it probably could be extrapolated to many other parts of America as well. In the first column, we have the types of gifts that the physicians were receiving in the study. It has the average cost of the prescriptions that they wrote, and then it has the average percent of brand medications of those prescriptions that they wrote. So, as we go through this chart, those physicians that didn't receive any gifts from pharmaceutical companies had an average prescription that they wrote that cost $85, and 26% of the prescriptions that they wrote were for brand name medications. Now, for physicians that received gifts, but those gifts were for less than $500, their average prescription cost was higher. It was $114 per prescription. And the percentage of brand medications that they prescribed was also higher. It was 30%. Now, we have physicians that received gifts of greater than $500. And guess what? The average cost of their prescriptions was still higher at $189 per prescription on average, and the percentage of their prescriptions that were brand name prescriptions were also higher at 40%. Now, it's important to note here that this is correlation, right? This is not necessarily causation, but there seems to be a pretty direct correlation here between pharmaceutical companies paying doctors and doctors prescribing more expensive brand name medications. Now, the big point of today is, okay, because this has been reported everywhere, right? You know, influence the pharmacy, gifts, yada, 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 influence the doctors, they prescribe the expensive stuff. Okay, fine. But the next study, which is also incredibly interesting, looked at a medical education session that was sponsored by a drug company. And it was small. It was only for 20 doctors. But they found that after that sponsored session by the drug company, that the prescriptions increased by 300% for two of the medications promoted by those drug companies. Okay? So, like, not up by 50%, not up by 100%. It tripled. And here's the interesting thing. 19 out of the 20 doctors, in other words, 95% of the doctors, believe or denied that the sponsorship by the pharmaceutical company had any impact on their prescribing. So only one of the doctors was like, yeah, I listened to the drug company thing and I thought it was a good idea, so I increased my prescribing of XYZ drug. Like, the other doctors totally denied it. They were like, look, I might have gotten a free lunch, but I did not change my prescribing habits whatsoever because of that. And that's obviously not true. So the point is that this is happening subconsciously. So that if you go to doctors and say to them, look, you're being influenced, look, they'll they won't be lying to you. They honestly don't think they're being influenced. Okay, so this comes from a blog by Dr. Jason Fung, who's a fairly famous and controversial, he's a nephrologist in Canada, actually, but he has a widely read blog that he writes. And in this blog where this data comes from, he says, look, there are some solutions, they're pretty straightforward. Look, doctors should not receive any outside compensation. The guidelines for publishers, or the folks, the doctors and the organizations that publish guidelines for treatment of hypertension or high cholesterol, etc., they shouldn't have any conflict of interest. In other words, the pharmaceutical company shouldn't pay the people creating the guidelines. Likewise, journal editors that are deciding which articles are getting published or not published, which can like make or break a researcher's career, should also not be paid by pharmaceutical companies because they might publish articles that are in favor of pharmaceutical companies and not publish articles that are against pharmaceutical companies. Okay, and that's fine. That's high and mighty. That's lofty goals. I mean, it's laudable, but let's be realistic here. And this relates to yesterday's video as it relates to a hospital system that also runs a health plan. In other words, they're essentially taking capitated risk because they're collecting premium and then using that fixed premium to provide care. So hospitals that run health insurance plans, in effect, they would police themselves, right? They would want their doctors prescribing the highest quality, lowest cost medications. They wouldn't want those doctors prescribing high cost, low quality medications because they're being paid outside gifts by pharmaceutical companies. So, like, it would make sense that if you had a hospital system that ran a health plan, that you wouldn't get this type of shenanigans. And guess what? That's exactly what you get at the Kaiser Permanente healthcare system in California, where in 2005, they banned their physicians from receiving outside gifts like tickets or meals or honoraria, which is a payment for speaking for an educational session. Okay? So, my point is that we don't necessarily need like acts of Congress or what have you. Just know that if the financial incentives are correct for the healthcare provider, doctor, nurse practitioner, etc., then a lot of this stuff works itself out. And that's my point for today. Thank you for watching A Healthcare Scene.